Here's something I know you'll want to hear about. That's right, ear infections. Now, I know, but that's not what we're talking about. We're talking about ear infections. Ear infections are one of the most common infections that kids get and one of the most common reasons for kids to need medical attention. But most people don't really understand ear infections very well. Even some very good medical providers don't have a really good understanding about ear infections. So let's change all that right here today. Now, before I go into explaining what happens with an ear infection, I want you to understand a basic science principle called fluid stasis. The idea is that when fluid sits someplace and there's bacteria in that fluid, that bacteria may overgrow. And that's really what's happening with an ear infection. Let me explain. So here's a model of the ear. This area back behind this eardrum or tympanic membrane is where fluid gathers and typically drains out all by itself through the eustachian tube, which is this little tube here. The eustachian tube goes to the back of the throat, and anytime there's some irritation in the back of the nose or throat, such as with a cold or respiratory infection, even allergies can cause that eustachian tube to be blocked up at the end. And then fluid can't drain out very well, and then it sits. Now, there's normally bacteria all over the body, and there are particular bacteria in the ear canal and in your nose and throat. That's normal. They're supposed to be there. But when fluid gets trapped, fluid stasis, that bacteria can grow, and that's what causes an ear infection. Most ear infections actually can come and go very quickly, within a matter of hours, all by themselves. So we found that for many kids, the best way to treat an infection is actually not to treat it, to watch it for a couple of days and see if it gets better all by itself. So for most kids who are over the age of 1 year old and are not very sick or with really high fevers, the treatment of choice for the ear infection is to watch it. Now, for kids who are very sick, or kids who are under a year of age, or kids who have other risk factors, or have not gotten better after watching an ear infection for at least 48 hours, an antibiotic might be used to kill those bacteria to help get rid of the ear infection. But those antibiotics don't take care of the fluid in the ear, which is why sometimes the antibiotics don't work or ear infections keep coming back. For some kids who get lots of ear infections, one way to treat them is to put a tube in the ear. And what that tube does is that tube goes across the tympanic membrane, the eardrum here, and that allows that fluid to drain into the external ear canal, out into the ear. And you may see that fluid. So kids with tubes in can normally have drainage in their ears, and that's that fluid getting out of there so it doesn't get infected. Now, that can actually happen with some kids with ear infections too. If you see a lot of fluid in the ear canal or the outer ear, chances are there's either been an ear infection that the tympanic membrane has ruptured and that fluid has caused enough pressure to break through and is now leaking out the ear canal, or the infection is actually in the ear canal itself and it's not in the middle ear. The only way that you can really tell if somebody has an ear infection is to have somebody actually take a look in the ear canal and see that tympanic membrane to see if there's fluid there, to see if there's infection or redness or inflammation there. You can't tell just from symptoms or just because a child has a fever. Many ears can be tender for lots of other reasons. Notably, sore throats and toothaches can cause ear pain. Lots of other reasons why kids may be pulling at their ears. And in fact, some kids who have had lots of ear infections may pull at their ears or have pressure in their ears and discomfort even without an infection being present. If you think your child might have an ear infection, do bring them in to be seen so that a medical professional can tell if there's an infection there. But don't be alarmed if that medical professional suggests you don't treat that ear infection right away. So I hope you've learned a lot about ear infections. Here you go. Parents, you got this. See you soon. Please hit that little thumbs up to like this video, subscribe to our channel, and then hit the little bell so that you won't miss a thing.